It's a 10th anniversary, and so we figured we better do something about it. Appropriate use criteria for cardiac imaging has now been available for 10 years, so it's probably time to ask, has there been an improvement in appropriate use of cardiac imaging? And I'm happy to welcome back Thomas Marwick, MBBS, MPH, MPhD, and from Menzies Medical Research Institute, Hobart, Tasmania, down in Australia.
Correct.
Now, we're discussing a paper of yours in the March 3rd, 2015 issue of JACC, Temporal Changes and Appropriateness of Cardiac Imaging, a Systematic Review. First off, why did you do it? I mean, it is the 10th anniversary. It's a nice way to celebrate, right?
It is a nice way to celebrate, but an important one. I think people are used to this being an important topic, and we're interested in whether practice has really changed. And so, although there have been studies that have tracked the behavior of individuals in response to education, we were interested in whether the reports in the literature had changed, and the results are interesting.
Well, what we're seeing is a lot of people are using these now in their own offices so that they can see, okay, these are the people who need to come up a little bit more, and these are the people who are doing just spectacularly well. But you're looking at it more broadly across the population, correct?
Yeah, that's correct. So the idea was to move away from that, because obviously people's behavior changes when you're looking at them, and instead to look at what people are reporting in the literature. So we did a systematic review of the literature to have a look at the reports. And the interesting thing is that some modalities have improved, some modalities have stayed the same. The proportion of what used to be called inappropriate and now called rarely appropriate studies has actually increased in some modalities. And you know, we think these results are important because we need to move away from just seeing how people classify the indications for the test, because it's possible to change what boxes ticked according to what the appropriate use criteria described to actually how they're behaving.
I mean, it was the stress imaging, wasn't it? The kind of that
it absolutely is.
That had is the problem child at the moment?
It is a problem child. Well, I think in summary, the results are that transthoracic echocardiography and transesophageal are doing pretty well. They're 80% roughly, and have increased with the new version of the appropriate use criteria. So I think they're doing pretty well. The stress imaging is not doing very well. And CT has improved, but from a low base. So stress imaging is of the order of sort of 60 to 70%, and the CT started off in the 50s and has improved. But interestingly, the rarely appropriates have increased for the stress imaging. So we have some problems here.
Now, in terms of, there has been a change of vernacular. It used to be totally inappropriate, and now it's kind of rarely. Could that actually have kicked numbers up? Did you look at anything like that as to, you know, from before it was like, no, no, no. And it's like the doctors, the reason they wanted it changed is because on occasion, on those rare occasions, we'd like to use this. And now the terminology has changed. And so they have a little bit more room to wiggle and say, yes, it's not totally inappropriate. In this case, it is appropriate. Otherwise, how do you explain the numbers?
That is interesting. I think some of this is about moving the goalposts, because for each of the modalities, there was an initial iteration, and then this has been revised. And so what we've looked at in most of the paper is the change between the first and the second versions. But interestingly, in each of those phases, we looked at the time that the data were collected in each of the papers to have a look at the appropriate use and to see that if there was an increasing trend over time. And disappointingly, really there hasn't been. So this, I think, is a lot of the story is about moving the goalposts rather than necessarily changing behavior. But what you propose is interesting. It will be, I guess it will be tough to get to that from our kind of systematic review meta-analysis approach. That would be more something that maybe you'd need to have an individual study to look at.
So where to now?
Well, I think it is worthwhile perhaps thinking about exactly what we've achieved with this. I think what it's given us is a metric that we're able to examine response. But my suspicion is that we need something more than we've already got. I mean, this literature is not as scientific as we would like. Most of the reports are retrospective. There are variations between observers about what's called appropriate or rarely appropriate. It seems as though, we looked at physicians versus nurses versus, for example, sonographers, and there are differences within those groups as to how concordant the observers are. I think that maybe we should perhaps contemplate a strategy at the point of testing rather than at the point of ordering. Because if it's done at the point of ordering and there's somebody waving a stick, it is highly likely that another box is going to be ticked, right? Look, I think it has been an interesting exercise. It is only one way of looking at this. There's certainly a group of authors that have looked at this within individual centres and have shown a change. It's hard to show that those changes are sustainable. And really, perhaps we should think about other steps than just measuring appropriateness, such as, for example, bundled care, so as to incorporate the incentive of this into improving quality of care.
Well, it's interesting because you probably set out and didn't expect the findings that you ended up with.
Not completely. I think that's absolutely true, actually. We expected to see that there would be limited change. We didn't expect to see the differential between the modalities. We didn't expect ECHO to have done as well as it had done. And we didn't expect the increment of rarely appropriate testing.
Well, it's always interesting, and that's why I love science, because it's not always the way you expected it to come out. And this happens to be from the March 3rd, 2015 issue of JACC. Please look for the paper there. And for CardioSource World News, I'm Executive Editor Rick McGuire.